Hi folks, it's Pat Deegan, and so far in this short series on personal medicine, we've learned that personal medicines are the things we do to be well. Secondly, we learned that personal medicine really is medicine and that it is deeply personal. It's not some generic coping strategy. Rather, personal medicines reflect the beauty, the inner wisdom, and the incredible resilience that I believe exists within each of us. Today I want to share a third dimension of personal medicine, and that is finding the right balance between what we do and the medication that we may take is the pathway into recovery for many of us. Now, this issue of finding the right balance between any psychiatric medications that we might use and our personal medicine is extremely important. Sometimes personal medicine and psychiatric medications can get out of balance. And when that happens, it means that the psychiatric medication is having side effects that are making it impossible to use some or perhaps even all of our personal medicines, right? For instance, if being a good parent is powerful personal medicine for us, and the psychiatric medications that we're taking interfere with our ability to parent because we perhaps don't have any energy, then there is an imbalance between the psychiatric meds we're using and our personal medicine, and that needs to be corrected. Finding the right balance is the key. When psychiatric medications and our personal medicine are in balance, a kind of synergy is created between the medication and our personal medicine. For example, if psychiatric medication is helping us feel less depressed, it might be possible for us to then become more engaged with our personal medicine, which is being a good parent to a child. And then, as we are parenting and being that great mom, perhaps, that we want to be, what happens is that medicine, that personal medicine kicks in, right? And it helps me feel better about myself, which in turn is an antidepressant, right? Which in turn, feeling good about ourselves raises our self-esteem and, continues to help us be that great parent that we want to be. And so when psychiatric meds and personal meds are working together and are in balance, then we're moving forward in terms of what matters to us in our life. And that's what healing and recovery are really all about.